begin with. If this is a little bit too hard though, you can get a higher raised surface, so the lower you go, the harder it will get. What you want to do is get into that split stance squat position, so one foot needs to be directly in front of the other. So some people turn the back foot out like this, which is incorrect, and it's also making the exercise easier. So we want to have one foot in front of the other. Front foot will be elevated on the box. You take a big step back, sort of a stride length. The toes on the back leg can be elevated to support you. And then what you'll do is you'll lean into the knee joint. So you want your hamstring and your bum to go onto your calf muscles. So it's not a lunge down, it's leaning forward, knees over toes. And this is working on this hip flexor mobility, so stretching the hip flexor, but it's also great for knee patients because it's loading that knee joint and also working the quadriceps eccentrically. So normally I hold that for 6 seconds and you can do 3 sets of 6 each time. So guys, the progressions for these exercises, so where you're going to start is on a 24-inch box. So again, as I showed you in the previous video, split squat stance position, one leg in line with the other, and then you're just going to lean into that squat. So glutes are going and hamstrings are going towards the calf muscle. And you should feel that here on the hip flexors stretch. So once you've mastered that, you'll then go on to a 12-inch box. So the lower you go, the harder it is because you're having more range. You're having to move that hip into more range. So you'll have a greater stretch of this hip flexor because you're getting it into more further extension the lower you go. And it's obviously harder on your quads eccentrically to hold that position as well. So if you're quite tight, start with a 24-inch and then progress downwards. And then eventually you can go on to a 6. Again, it's a lower box, so you'll feel that stretch more on that hip flexor. So once you've mastered the box progressions, you'll then have a go on the floor. So obviously this is the lowest surface you can get. So as long as they're all pain-free and you're not feeling an overstretch of the hip flexor, it's just a nice stretch, then you can go onto the floor. So again, same position, leaning in to that stretch. So another progression once you've mastered that one, again no pain, a nice stretch. Then you can get some kettlebells to add some weight to it to make it a bit harder. So first one, you're going to have the kettlebells down by your side. So again, same position, one foot in front of the other. Make sure you get your balance. And then lean into that squat position. Okay. So once you've done that, again, making it a little bit harder. So we're going to add the weights up onto our shoulders. So you want to twist them and catch the kettlebells within the shoulders. And then again, same position, leaning into that stretch. So that's going to make it a little bit harder because you're having to go against gravity and hold that weight onto your body, so you're lifting a heavier load. So to further the progression from the kettlebell weight, so once you're moving on to, once you've got that mastered, there's no pain, and you feel like you need to progress onto a further weight, then you can use a bar. So this is 20 kg. So Sam's going to show you how to use it. So you'll put it onto the back of your neck. So you are loading the spine with this exercise, so if you're not comfortable with bar exercises, then speak to a qualified professional, or you could practice on the Smith machine first. This is a little bit easier, as you've got that support there to catch the bar. So, again, same sort of movement. So you're going to lean into that stretch, loading the quads, and returning. So this just just adds a bit more weight to the exercise. Again, pain-free at all times. If you have back pain specifically, maybe try to avoid this progression or speak to a qualified professional before trying it. So, your final progression, you can add some plates onto your bar. Again, if you're finding there's no pain, you've dealt with the 20 kg of the bar quite well, you're ready to progress that weight. Again, on the back of your neck, loading the spine and then bending forward again into that same position as we talked about before, and returning. So again, it's loading the spine quite a lot, so just make sure to be careful with this exercise. Again, you can practice on the Smith machine or speak to a qualified professional if you do have any pain or you're not quite sure how to do it just before trying this exercise.